During my medication administration video, we have Travis here, and I have my patient Alyssa. Here is my supplies and where I'll be brain dumping. This is where I'm doing my first check with the provider order and the MAR, and this is where my second check will take place. Travis is going to time my brain dump for a minute. All right, and I'm gonna start. Okay, so I'm going to start with discussing the drugs today. So starting with the two pain medications, oxycodone and codeine. We will not be administering the two pain medications because Joe here does not have any pain. Alongside his bowel obstruction, we don't really want to encourage these narcotics because he could become at risk for constipation, and we don't want that. So other medications we will not be giving today is furosemide and digoxin. Joe's digoxin level is 1.9 and the therapeutic range is 0.8 to 2.0, and although that is within therapeutic range, Joe's potassium level is low. It's at a 3.4 and the therapeutic range is 3.5 to 5.0. So with the potassium being low, we don't want it to dip any lower than it already is. Our motive is to increase Joe's cardiac output, not decrease his cardiac output, and make his heart work harder than it already is. So we don't need that. So with warfarin, some nursing considerations, I will monitor his BP. I will check for any signs of hypertension. I'll check and make sure he doesn't have any bleeding gums, and check that the dosage is changed every 1 to 2 weeks. So starting off with a few questions here. Are you in a comfortable position?
Yes.
Have you had any recent lightheadedness?
No.
Any black stool?
No.
Any abnormal rashes or scabs?
No.
And what kind of toothbrush do you use?
Soft.
Have you had any issues with that?
No.
Okay. Yes, with that, have you had any bleeding gums when you brush your teeth? Okay, just want to verify that. So, I've already asked if you're in a comfortable position. So with equipment, I would cleanse and sanitize my equipment, but I've already taken Joe's blood pressure here. It was within normal range. So if I'm just gonna do it, whatever. I'm just gonna cleanse the stethoscope. And then Joe, I'm going to go prep your medication, so I will be back shortly. So starting with the medication administration record and the hospital provider order. So looking at right patient, so Joseph Smith, 10/5/1954. Right drug, warfarin. On both sheets I have warfarin. Dosage is 5 milligrams, 5 milligrams. PO by mouth on both sheets, and daily given. So this med has not been given yet today, so we were able to give. Joe here is taking this medication for his atrial fibrillation. And I'm going to put the provider order away, and I'm just looking at the MAR here. So starting with my first check, I'm observing the med card here. I'm going to pull out warfarin, and I'm going to be checking off the medication and the MAR here. So starting with right patient, we have Joseph Smith. Right drug is warfarin. Here I have warfarin on both, 5 milligrams. We have a 5 milligram tablet here. Since this is equal, we have 100% accurate dosage. And then along with the PO by mouth, given daily. This medication has not been given yet today, so we are able to give. Joe here is taking this medication for atrial fibrillation. I'm just trying to make sure. Yes, okay. So checking the integrity of the packaging, there's no rips, it has not been opened, so integrity is good. Expiration date is 12/31 of 2034, so it is not expired, so I am able to give. I'm gonna place it in the med cup here. I'm going to grab my MAR and my med, head on over to do my second check. So with my second check, I'm gonna pull my med out, looking at right patient. So Joseph Smith, warfarin, right drug, right dose is 5 milligrams. Here we have a 5 milligram tablet. This medication is equal, 5 milligram. There's no reason to split, cut, crush the medication. And it is by mouth, PO, and it is given daily. This is med has not been given yet today, so we are able to give. Joe is taking this medication for atrial fibrillation. So I'm going to checking the integrity of the packaging. There's no rips. It has not been open. Expiration is 12/31 of 2034, so it is not expired. We are able to give. Placing it back in the cup. I'm going to move on over to do my third check. Okay. Hi, my name's Hannah. I'll be your student nurse today. And hygiene. The door is closed for privacy. Can you state your name and date of birth for me, please?
Joe Smith, 10/5/1954.
I'm just going to verify that on your wristband here, and while I'm here, I'm going to scan your wristband. For this assessment, I will need PPE, so I will apply before I administer the medication. I'm going to come over here and check the provider order. It looks like we are going to be administering warfarin today. Is that okay?
Yes.
Awesome. And then before we begin, is there any allergies I should be aware of?
Sulfa and betadine.
Okay. So starting with my third check here, looking at the drug and the MAR. Right patient, Joseph Smith. Right drug, warfarin, 5 milligrams, 5 milligram tablet for dosage. Since this medication is 5 milligrams tablet, there's no reason to cut, crush, anything of the sort. 5 milligrams to 5 milligrams is equal, so we know that we have 100% accurate dosage. PO by mouth, given daily. This med has not been given yet today, so we are able to give. Joe here is taking this medication for atrial fibrillation. And with warfarin, it is a high alert medication, so I had a nurse come and check to make sure I'm able to give. With that, I'm going to place it back in the cup here, and then we're just going to go over a few things about the drug here. So some common side effects we're going to watch out for is rash, nausea, cramps, and fever. Some life-threatening side effects we're also going to watch out for is hemorrhage or anaphylaxis. The action is to prevent the prevention of clotting or pulmonary embolism, and in your case, Joe, we're doing it for AFib. Along with that, can you tell me a little bit about why you're taking warfarin today?
For my AFib.
Okay, perfect. Patient was able to teach back why they are taking this medication. I am now going to scan the medication. It is warfarin, 5 milligram tablet. And are you able to take this medication orally with water?
Yes.
Perfect. So with that, I'm going to grab some gloves here. Okay. Do you have any concerns or questions before we begin?
No.
Okay, so I've already made sure the patient can take this orally. I have scanned the wristband and the medication. I have told you the action and the side effects we are going to watch out for. You told me you did not have any concerns. So I'm opening the medication in front of the patient. Joe, you do have the right to refuse, but are you okay with taking the medication today?
Yes.
Okay. So I'm going to Grab your water cup here. Are you in a comfortable position?
Yes.
Perfect. All right, and I'm gonna stay with the patient and have Joe open his mouth here to make sure that the drug was administered, and it was. So I'm gonna remove my gloves and I'm going to document here. 15:55. Okay, so I am going to gather and cleanse my equipment and clean up my supplies before I exit the room. Let me think here. So I have already verbalized why I held the medications and why we gave the medication that I did. Since I gave an oral medication, I will come back in the next 30 minutes to assess for any adverse effects. If there were to be any adverse effects, I would withhold the next dose. I would assess vital signs, making sure to definitely monitor that blood pressure again. I would notify the prescriber, provider, pharmacy. I am going to have to notify them on the medications that we held today and why, due to Joe's potassium level being low. And I'm going to document any abnormalities, which I did not find any abnormalities, and Joe did not express any abnormalities today, but also documenting per agency policy. And clean my equipment. Asked if you were in a comfortable position. While I'm here, Joe, do you have any questions for me? I have the time.
No.
All right, so I would make sure that the bed is locked and lowered, side rails are secured, call light is within reach, table is within reach, and pathway is clear of any obstructions. Performing hand hygiene, the 5 moments of hand hygiene are before touching a patient, before procedure, after touching a patient, after touching a patient's surroundings, and after touching bodily fluids. I'm just gonna run through this just to make sure I hit everything. So first check. I said the reason was for atrial fibrillation. Second check, reason for atrial fibrillation. The correct dosage. We did not have to split, cut, any of that. Warfarin is a high alert medication. I verbalized that I would have to verify with a second nurse. I have documented. Scanned your wristband and med. You told me why you're taking the medication. HVAC was good. Okay. I'm gonna go document.